Hello, Women's Healthcare Journal readers. My name is Shannon Linder, and I am an assistant clinical professor at The Ohio State University College of Nursing. My nurse practitioner certifications are as a family nurse practitioner and a psychiatric mental health nurse practitioner. My current practice is working both outpatient and inpatient as a psychiatric mental health nurse practitioner, in addition to teaching in both the psychiatric mental health nurse practitioner and family nurse practitioner programs. Dating back to clinical as a FNP, my women's health rotation was my favorite clinical experience. And then after personally having 4 children of my own, including a set of twins, I have spent a significant portion of my life in the prenatal and postpartum periods, like many of our patients. Now having to balance the work-life situation with working full-time and taking care of 4 little ones at home, I feel privileged to be the psychiatric mental health nurse practitioner provider for patients with mental health concerns, hoping to navigate the balance and self-care in their own lives. In the article, Promoting Mental Health Self-Care Strategies During Pregnancy and Postpartum with Motivational Interviewing, my colleague Randy Macciola and I discuss motivational interviewing techniques that can be used to help women in the prenatal and postpartum periods of life to improve their self-care goals and decrease overall levels of stress. In the article, you will learn about specific strategies to be able to use motivational interviewing with your patients. One of my favorite first questions to ask patients is, what are you doing for yourself? Oftentimes they look at me like, what do you mean? I just had a baby, or I have small kids at home, and I work full time, or I stay at home and take care of the house and my kids and everything else. There's no time for myself. Sleep is also often deprived. Once the patients begin to realize that self-care is not selfish, I ask them to consider a self-care goal they may have for themselves. Examples may include exercising more, having a healthier diet, using meditation or mindfulness, reduction of substances, reading more, improved sleep hygiene goals, or improved relationship support. Patients typically respond well to initiating the self-care strategies on their own, something that works for them, their schedule, and their families, versus having a provider tell them, you need to exercise, you need to lose weight, you need to quit smoking. This is one of the reasons that motivational interviewing can be significantly beneficial. I ask permission with my patients to give them examples if they need some guidance on what types of changes to make or how to make them. Using the 5 stages of change is also very helpful when working with patients using motivational interviewing. If you are interested in learning more about the motivational interviewing techniques in the prenatal and postpartum periods, you will enjoy reading this article. I personally try to strive for wellness, being a busy mom with small kids at home, and my hope is that reading this article, as providers, we can try to help patients with their self-care habits to reduce stress and mental health complications in this field. Thank you all for your time.